So first few things that I've seen that need to be commented. First, if you're a female therapist and you feel that you don't want to have your breast touch the arm or shoulder, then you can do it also with a pillow or with folded towel. You just hold that in here. That looks quite big, yeah? And then you can more securely feeling easily, because sometimes just that can bring tension and uncertainties and misunderstanding between you and the client. Okay, so let's, yeah, okay. Do you see how, you need to come closer, also to the other side. You see how the pillow here is actually non-functional? Because when I start moving that, do you see how the head falls forward? So what you need to do is lift your head and then arrange it in this way. Okay? So now we'll take that, what we've learned, and put it into more just general treatment. And again, I'll show you approaches. Approaches is where you can stand. Position. Yeah? The first position is near the shoulder. The second one is above. The third one is opposite side. Yeah? So let's start from here. I'm going to show you other techniques, like we did some stretching, I think you did with Sally. Yeah? So certain technique like stretching, you know, you can do that here as well. You can do that around the wrist joint, but sometimes what I feel is that the wrist joint is quite weak for that. You can hold it just above the wrist joint and stretch. Do you feel the stretch? Especially for people who like really deep tissue, sometimes it's nice to do long and not strong stretch. You start, let them feel their body, as opposed to just abuse it. Like more pressure. You know the pressure manics? Mm-hmm. You know, more pressures, yeah? Was it effective for you, yeah? Okay. Then you can introduce oil. Can I tuck this under, yeah, like that. So I'm working just on the neck and shoulder right now. Yeah, I can do that, knuckles into here. It feels really nice. But what happens is you have contradicting movement. You start from here. If I go closer to her skull, do you see what happened? I need to go there. So you actually end up here. So nice work around the erector spinae. It's still not great. Something is not great in here when it comes to her head. Yeah? Okay? And it's probably this shoulder a little bit. Yeah? Good. And yeah, lift your head for a second. Yeah? Okay. Is it comfortable?
Yeah.
Yeah? Okay. So, a bit of pec massage. Then you move into these knuckles. And then you can start mobilization. Okay? So, all I'm doing is just moving my weight. And I mobilize with it. It should be at the end that easy. Yes, you might want to be a bit more on it, but and more strong, but also make it easy for you. Okay? Once I establish the mobilization, I start working with my soft tissue. Soft tissue is just a Swedish massage, if you want, while I'm working there. So especially I like to do that when the client is in a lax position, when the shoulder is up, because this is where the muscle is really soft, and I can squeeze it softer, improving blood circulation. Yeah, I'm looking for the levator scapulae muscle on the medial side of the shoulder. I'm working with one finger really. And that's correct, when you're feeling, when you know where it is, you don't need a lot. You can just with one finger to create enough pressure. And défleurage. Okay, one muscle, and this will be the muscle of the day. Yeah, muscle of the day, infraspinatus. Yeah, and if you want ever to trick your client, to show them that you can know where there is an active trigger point, you just need to go there. Okay. Do you see her face? Okay. It's we can call it the wasabi muscle. You know, when you're eating wasabi, you feel like, ooh, that, yeah. So, infraspinatus. Why? I'll tell you some other time. But this is to work on a lot of problem in the shoulder area. Reflect some issue with the infraspinatus. So, I wouldn't say all, of course, but for now, I want you to palpate it. Now, how to palpate? You feel the lateral border. You might need to come around here, you know, yeah? You feel that this is a scapula. You feel the lateral border, and you go from the lateral border into, and that's a ridge. You will find a hard ridge. Tender? Mm-hmm. Yeah, okay. You can do it also a bit less tight tension with the base of the wrist, and you can distract it with movement. Okay. Few more things, okay? When it comes to mobilization, I'm not sure if you've done it with Sally, yeah? At the beginning, just observe the scapula. Put your hand in here and try to feel how the scapula moves. This is what, it's almost like need an imagination and knowing where the scapula is, and then start to move. Because actually when I'm critical about it, I don't feel the whole scapula. I feel maybe a bit here and a bit there, but a lot of it is covered with muscles, yeah? So that's why you need a bit of imagination to go with. And I want you to feel that here is infraspinatus, here is teres muscles.
If somebody was having pins and needles in their fingers, would they...
Well, while I will do it, first of all, I would distinguish between if it's when I put their arm up, probably I do something, so I try maybe less. But sometimes it just means that the muscles is tight, and when you have trigger point therapy on that muscle, and that's what we're doing, you will have some symptoms. But it may be therapeutic. If they're coming with trigger point, then I might stop it. But if they start having these pins and needles, I would say, okay, that's to do with the trigger point, and I will continue. So you can do the same thing here, coming from here. It's almost like mobilization, and I feel the lateral, can you imagine the lateral border of the scapula? So that's where the base of my wrist attach, and then I can move that. and massage the teres muscles, both of them. Now, I'm not massaging the whole muscles. I'm just feeling the edge of the bone, and I know that the muscles are attached to this bone, to here. I think it's enough, isn't it? It's very detailed, and you see I mean, I show you only, I don't know, 10% of everything, but there is a lot of details. What I would like you to do is to get acquainted with this area. How do you feel the scapula?
Mm-hmm.
And then imagine which muscle, remember the body paint we've done, which muscle comes from here to where? That's the anatomy we need to know, not the exam. You know, feeling this muscle and that muscle, okay? But more the live anatomy. I'll come around, help, and the person who lie there, you'll not be treated, but try to talk muscles and talk anatomy and see how that relate. Where is the scapula? Where is levator scapula? Where is rhomboids? Where is infraspinatus? Where is supraspinatus? Yeah?
Mm-hmm.
That's what we want, that kind of information. Yeah? Go for it?
Yeah.
Cool.
Which side you want? This one?